Hi, I just wanted to connect this week about the idea of health in all policies. And so it's really an approach that systematically considers health and social implications of policies that across all sectors of government. So we really are focusing on synergistic benefits and really focusing on health equity, so minimizing social and health related harms. It's this critical policy lever because many of the drivers for health outcomes, so risk factors for disease, inequitable access to care, socioeconomical and environmental determinants of health, are really beyond the reach of the health sector. So it's considering how all of these siloed pieces of government could work together to support health. And it really focuses on population health and health equity, and thinking about, how different sectors can really change policy to affect, upstream drivers of health and social outcomes. So, in Canada, we have kind of a few examples of health in all policies that have been impacted. So this idea of targeted intersectoral action. Things like driving deaths and disability from traffic accidents have been addressed in Canada with this approach, considering better road design, considering effective prevention of driving, and also tougher transportation regulations. Lower prevalence of smoking is another example, thinking about tobacco control measures that have been implemented across government sectors. They've had multiple impacts. They've had economic impacts, saved money for the government, but they've also reduced morbidity and mortality for Canadians. And so there are lots of opportunities for these collaborative intersectoral approaches that could really improve health and health equity in Canada. And so this is kind of the focus of health in all policies. Non-communicable diseases like cardiovascular disease, diabetes, kidney disease are really the leading causes of morbidity and mortality worldwide. They also have a huge economic pressure on governments. And so, when we think about where the money is being spent, public expenditures in Canada really relates to medical treatment of acute and chronic complications, rather than prevention of the root causes. And so what happens if we took an upstream or preventative approach, considering, multiple different sectors of the government, thinking about addressing diverse risk factors like climate change, thinking about sedentary lifestyles, thinking about hazardous working environments, and thinking about diet and food, alcohol consumption, tobacco consumption, sodium consumption, and all of these pieces. How can we work together in these 10, areas that tend to be siloed to work together on improving health in certain areas? Another way that health in all policies approach can be considered in Canada is our approach to promoting mental health. So, mental health conditions are this subset of non-communicable diseases that, particularly been neglected worldwide, despite the growing health burden. And so there are lots of gaps in prevention and upstream approaches to mental health. This is really highlighted with lack of early access to early interventions, failure to ensure adequate treatment in early disease or established diseases that already exist. And so, let's take a look at this, right? From different approaches, from different lenses across different government sectors, considering, social economic status, social capital, individual resilience, thinking about how we can approach supporting those pieces to create more health equity, and have kind of more, enthusiasm across government sectors for this broader action on social determinants of mental health. And so there are, some barriers to this health in all policies approach. The legal structures, the governance frameworks, those underlying processes for government collaboration really don't exist, but they're happening. And so this idea that, there's barriers that need to be broken down, especially in Canada, with respect to, how to implement this health in all policies approach in action or in practice. And so, these balancing these policy objectives across different sectors is also challenging. And so, this week I really want you to think about this idea of synergistic and collaboration, and thinking about when you're in your individual discussion groups, thinking about, this idea of how can different aspects that we traditionally don't see working together or working on health work together.